Welcome to Spectrum Health TV. I'm joined by Dr. Bob Connors, a surgeon and president of Helen DeVos Children's Hospital. Welcome, Dr. Connors.
Thanks, Carrie. It's nice to be here.
I know the new Helen DeVos Children's Hospital is scheduled to open in 2011. Why do we need a new children's hospital?
I think that's a great question. I guess part of the story really is the growth of children's services here. Having been here for 18 years, I've seen it grow from what was just a floor in the old hospital to much larger programming now. In fact, that floor that was the whole children's hospital is now just part of our neonatal unit. We've really outgrown what we've been able to have in the hospital right now. And I think the other opportunity is that as we've grown, we've had to put services here and there and do the best we can. But we know that we can provide the care better if we have a facility that's really built for that. So we had the opportunity to talk to a lot of families and kids and caregivers when we were doing the planning for the hospital. And it's very exciting to have an opportunity to plan to actually do the care better, to build care instead of just building a hospital.
And I want to ask you, how does family-centered care factor into the design of the facility?
Yeah, it's really probably the most important thing that we looked at. We're very committed to having kids with their parents and their brothers and sisters as much as possible when they're in the hospital. It's a very stressful time for the family. So it's very natural for us to want to promote that. And some of the design features are very clearly designed for that. For example, we don't have very many standard nursing stations because we think it separates the nurses from the kids. So we've designed it so that the information they have is by the bed. It's close to the bed. The rooms themselves are going to be very large, so they're going to be very comfortable for families as well. And kids go different places in the hospital too, like to the operating room, and this design, I think, will be the most family-friendly operating room in the world, as far as I can tell, but it'll really promote families to be there with the kids as they're going to sleep, as they're waking up, really try to keep them together for that support.
And what program enhancements will there be?
Well, our sedation program is a good example. You know, kids are uncomfortable and they're scared when they're in the hospital, but they have to have a lot of procedures. And they don't typically hold still very well for x-rays, and they don't understand about needle pokes and medicines that sting. So we have a very big and very active sedation program. And right now we kind of have to take that expertise in those facilities to different places in the hospital. We have to take it to the radiology department. We have to take it to the emergency department or our procedures area. And I'm really excited about a design of one of our floors where we've put the sedation program in the center and put those other programs around it so that we're really taking that program to the kids where they need it the most.
And I know none of this could have happened without the support of our community. Can you talk about what that has meant to this project?
Yes, I don't think you can say enough about the generosity of the Grand Rapids community in West Michigan. It's fair to say and accurate to say that we would not be building a new children's hospital were it not for that generosity. And that partnership has been very apparent all through the history of the children's hospital. In fact, I think it almost characterizes our children's hospital, this partnership with a very generous community. So it's been absolutely essential, and we take that partnership very seriously.
And it just proves that our community really wants this facility. So.
Well, I think so, and we're very grateful for that.
Well, grateful that you were here today to share this information with us, Dr. Connors.
Good, thanks, it's been fun.
And thank you for joining us for this edition of Spectrum Health TV.